Here's a presentation to help you be able to prescribe an Invisalign treatment. So let's start. That's the opening page. When you've clicked on Invisalign Doctor Site, this is the page that will open. So the username, obviously you'll have your own, and the password. And you log in. As you can see here, we have the list of patients in treatment. Now we are going to add a new patient. The last name will be John Doe, male, was born on the 21st. Month would be, let's say, October the 21st, 1997. And the zip code, you can put the zip code of the patient. I'll put mine. And you can go next. So this is the clinical conditions that Invisalign would like to know why you send the patient for. So let's say this patient has some crowding and he would have a deep bite and maybe some misshapen teeth. Again, you can put general notes also or some other. You could add missing teeth. I don't know if they are here. And you do next. So as you can see here, upload portrait patients now. Later we use composite, so we are going to skip this step. And now you can see that the composite is there. So you have to browse into the computer, and you had to have built the how can I say, the template. As you can see, this patient has a template right here that has been already, landscape. It has already been created on the Kodak template. So this patient now is dragged in here, and you can click next again. Takes a little while. All depends on your internet connection. Seems to be a bit slow today. Now you want to upload the x-rays. As you can see here, they don't provide for cephalometrics for a purpose. It's because Invisalign claims that they only are a lab and they don't do diagnosis. So you can go into thumbnails if you want to find your this is not the Panorex of the patient. It's a Panorex I've taken randomly. It's an old one. As you can see, it's an old picture, but just for the sake of demonstration. So we're going to be uploading again. And then what you need is you have to start the prescription. So we usually in the clinic, we use this one in the full Invisalign. There is a teen, there is an express when you only have 10 trays, where they only move anterior teeth. This one is for 5 trays. I've never used it. I don't quite know what it's for. The assist is when you start, you see it's a treatment option. And again, aesthetically oriented dual arch treatments, so it's for simple cases. And you have 3 refinements. We'll see what refinements are later. And then this is when you want to ask for Vera retainers, which are sets of retainers that you can get after treatment. And you can see the price right here. So let's start with the regular Invisalign treatment that we pretty much always use in the clinic. And then they will ask you, do you want to treat both arches? You say yes. Treat teeth to treat full arch on both sides, on upper and lower, sorry. Then the movement restrictions. Let's say you have an implant, you have a tooth you don't want to move, you have to click it here. Let's say I will, for demonstration's sake, say there was an implant on tooth number 6, so this tooth can be moved. Okay? And attachments, let's say this is again, per default, Invisalign will place attachments wherever they want to, and you'll notice that more and more attachments are present in our Invisalign cases. So Let's say this patient does not want attachments on the anteriors, so you'll place little crosses saying, I don't want attachments on these teeth. Sorry, I'll go back to make a comment. You can see here, I don't want attachments on the teeth, but I still may want para-ridges, which are little indentations into the trays to allow us to get better torque control. So this is an attachment that is actually bonded to the tooth. It's not a para-ridge. Then you get an AP relationship, so depending if it's a class 1 case you want to maintain, by default Invisalign thinks that all cases are either class 1 or you are not interested in changing the AP relationship. So you may want to just improve the canine relationship, which I rarely use also, or you want to, as you can see now, Invisalign tells you that they can improve the AP relationship by 4 millimeters maximum, meaning that full class 2 malocclusion will probably not be very well corrected with Invisalign. So once you've clicked, let's say we click both, you have a correction to class 1. So you can do some IPR, you can do some class 2 correction with elastics. In this case you will have to ask for precision cuts. Again, we'll look for that later on. And you can also distalize molars, and also you'll need probably precision cuts and elastics to hold the anchorage. Orthodontic surgery, I would tend to say that it's a little bit of a push, so let's stick to standard orthodontics for now. Now what you want to see, again, you have overjet. So usually you just click this one because the best thing to do is let the first Clincheck come back. And normally what you want, maybe you want to maintain the overjet if it's a patient is class 2 with some overjet, but usually I always click the show overjet after alignment. Same with overbite. See, again, show overbite. You may want to maintain it. You may have a deep bite, or sorry, an open bite. And then if you have the open bite, again, Invisalign not being the diagnostic company, they just are a manufacturer of aligners. They will ask you what you want to do. You want to correct the open bite, you want to extrude the anterior teeth, or you want to extrude the anteriors and intrude the posteriors. So you can also make some special requirements from the special instruction about the text box. Same idea for the deep bite. Let's say you want to correct a deep bite, and again, which one your anterior teeth you want to intrude. You're going to say I want to intrude the upper or the lower, or you can click both actually. Again, depending on the case. So yeah, you see immediately that you have to get a good diagnosis before you send the impressions into the Invisalign company. Midline is the same thing. You want to move, or you want to show the resulting midline after alignment, which I usually tend to do. Or you may say, well, please improve the midline alignment and I want to do some IPR to the patient's left, and the lower will be to the patient's right. So immediately Invisalign will know that you want movement from the midline in a very specific direction. The cross bites, you usually by default do not correct cross bite with Invisalign. It's hard to do, but if you really want to do it, you can ask the Invisalign to try to do it. I've done it a few times. I would say that simple cross bites are easy to do, but skeletal cross bite you should not correct with Invisalign. It just doesn't work. Spacing and crowding, same idea. You want to close all spaces. Or, again, if you do some prosthetic work where you are going to do some composite buildups or new crowns, you may want to tell Invisalign that you want to leave, as an example, 1 millimeter of space between the lateral incisors, and you may want to be, I don't know, that's pretty much, I'm pretty sure these spaces will not be corrected, but this may be important, and maybe 0.5 here, because you are going to rebuild the anterior smile by bonding or doing some porcelain facings to the to the anterior teeth. Okay? Or You could do also resolve the crowding. Then you have to, this is the big decision. Either you're going to expand the arch, dental-alveolar expansion, you're going to procline the incisors, or you are going to do some interproximal reduction, either anteriorly, posterior right, posterior left. So you see, you have to tell the lab technician which of the options you want. So let's say I want no expansion, I want no proclination, and I will do some primary IPR in the anterior and as needed in the posterior right and left. And on the lower, I could maybe procline a little bit, but I may be able to expand, and I don't want to do any IPR in the anteriors, and I may want to do, I don't know, just for the sake of it, I don't think it would be very wise, so no IPR. Okay, next. Extractions, usually we do not do extraction cases in the clinic, so we'll pass this one. Special instructions, depending on if it's a prosto case, if there is a broken down tooth, if there is a relapse from orthodontic treatment that you want to avoid, or anything you want to tell the technician before you start, this is where you write it. Impression tray replacement, well, maybe we had a medium upper and a large, they will send you the same corresponding tray when you send your box into the Invisalign. Every time they'll send you a new box for a box they receive. So now what's happening, you see the uploading is taking place. The x-ray is there. I didn't put a Ceph. I could have done it, but I didn't do it in this case. And then what you have here is a summary of the prescription. So if you like it, you can just review it, okay? And if there's something wrong, you can always say, oops, I did something wrong. In this case, I say, I forgot an x-ray. Let's edit this page. And you're going to browse for, actually next. You are going to browse for x-rays. You say, I changed my mind. I'm going to upload x-rays now. I'm going to browse for the Ceph. I still want to send them the Ceph, so I'll do it. And I put it right here, and I say next. So I've edited the prescription before I sent it. Again, it's just an example. This prescription will not go anywhere. And at the end, as you can see, every single mark I've put into the prescription is there. No extraction, medium, large. And then when you're ready, you can submit. Obviously, this one will not go because it's just a demo, but you submit on this blue button here, and Invisalign immediately will ask you to print. Will print. Actually, no, I won't do it. Just submit, print, and then you're ready to send your impressions and bite registration to Invisalign with our secretary. Thank you.